Namaskar. First of all, thank you all of you for your support in the previous episodes and for liking the idea of this talk show. Like in the previous episodes, I had taken suggestion from my listeners about what should be the topic of the next episode, and many of them suggested that I discuss something about post-COVID care, which is very important at this point of time. First of all, before going to post COVID care, let me tell you what is pre and intra COVID care. Pre COVID care is very simple. That is the three things: mask, social distancing, hand sanitization, and the fourth one is vaccination. Pre COVID, you need to follow these few steps to keep yourself safe from this pandemic. God forbid, if you are catching this virus and you are affected by COVID 19, then there are a lot of criterias about how your treatment should go. At the moment, we know that there is no specific treatment for COVID 19. Therefore, it is important that we understand what is actually the treatment of COVID 19 in a mild form, in a moderate form, and in a severe form. The high level committees of the health authorities of the country are continuously modifying the treatment strategy based on the ground report that is being collected. Recently, on the 17th of May, Government of India had issued a fresh notification about treatment protocols, in which one major thing was that Government of India finally dropped a, I would say, a mirage or a pseudo treatment that we were talking about, that is plasma therapy. I had told earlier that plasma therapy is no magic, it is just a passive immunization technique which is, whether though not very effective, but was giving some kind of a relief. Similarly, the use of remdesivir and tocilizumab have been greatly uh, channelized, and it has been uh, strictly restricted to hospital uses, that is in ICU. Researchers say that if you do not use tocilizumab within 24 to 48 hours of hospital admission, then there is no point in using that. And same goes for remdesivir when it is used between the 5th to the 10th day of the infection, then it is showing some kind of a good effect. Still, our physicians are using that because these are the only two effective antivirals available with us. And antiviral in general will give a broad spectrum effectiveness in our fight against this COVID 19. Now, what is important is that you should know when you are COVID affected, when you should get yourself admitted. Don't just rush to a hospital. COVID 19 can well be managed while staying at home. What is important is that you need to recognize when you need an hospitalization. A mild form of COVID 19, where there is only fever, little bit of body ache, weakness, and there is not much of shortness of breath, the saturation is maintained above 94%. In normal patients and in COPD patients, the saturation is maintained between above 92%, or for that matter 90%. You need not worry. You can get yourself isolated in a home, set up, and treat yourself and get well. Apart from the various multivitamin and supplementary treatments that you have been given, there is no other specific treatment for COVID 19 in a mild stage. In a moderate stage, some anticoagulants, some anti-inflammatory, and some antivirals are given in an patient admitted in the ward with the saturation dipping below 90. There will be alternate proning, and saturations would be targeted to be maintained near about 94%. As I said in the previous episodes, judicious use of oxygen and medicines is important in this fight against COVID. You all must have heard about the new post COVID danger that is being seen, that is the black fungus or mucormycosis. Studies have revealed that this mucormycosis or black fungus is being seen in our lungs due to excessive use of oxygen as well as excessive use of uh, anti-inflammatory medicines like the dexamethasone. Now, steroid is always a double-edged sword. It can harm the enemy, but at the same time, it can harm you. Anything in excess is bad, but an excess of steroid is always harmful for our body. This kind COVID-19 has a very typical feature. The COVID related viral pneumonia has a very typical feature of causing fibrosis. This fibrosis of the lungs means the lung cells are slowly degenerating and their elasticity is lost. They will be fixed and they will not be functioning as they used to. But this fibrosis is, in many cases, it is reversible. But in a case where you have given lot of steroids, lot of oxygen, these cells are in a dormant stage, and at the same time they become complacent, and the fungus develops in a wet and dampy area. We know that. So it is very simple why mucormycosis, why this black fungus is developing. This is certainly a danger that is knocking our door. We need to be judicious in our use of anti-inflammatory drugs. In the severe patients who are admitted in the ICU, we are giving them various broad spectrum antibiotics, and at the same time we are giving them remdesivir, tocilizumab, oxygen supply. There some are getting NIV, some are going into ventilators and all sort of things. They are the critical patients. Now let me tell you, for a mild patient to get out of COVID, you will require almost 14 to 28 days to be absolutely normal. For a patient who was admitted in the ward, you will require another, like say, 1 to 1.5 months for recovering to the best of your abilities. But a patient admitted in the ICU will require near about 2 to 3 months for complete recovery. Initially, when in an ICU, you will be slowly shifted to a ward, then you will be shifted to the observation, then you will be discharged. So that is the protocol. So it will your recovery will depend on the severity of the disease that you have suffered from. What you should do post recovery is something that is many people keep telling many things, but what I as a physician advise to all my patients, I'm going to share that with you. Be it a mild patient or a moderate patient or a severe patient, what is most important is that you need to revive your lung. You need to revive the capacity of your lung that has been severely affected by this viral pneumonia. The cells may have fibrosed, may not have fibrosed. There may have been consolidations, may not have been consolidations, but what is important is that you need to revive your lung capacity. For that, what is important is chest physiotherapy, breathing exercises, pranayam, yoga, and continuous steam inhalation twice a day, not more than that, for at least 2 weeks post recovery. You need to use the spirometer to pump in to do the breathing exercises. You need to do the pranayams. You need to continue vitamin supplements so that your lung cells are regenerated. We need to understand one thing, that the role of our lungs is not just breathing in and breathing out. What is more important role of the lungs is that it purifies our blood and it sends the most important oxygen to rest of the cells of the body. Therefore it is important that our lungs is at the best, so that proper good amount of oxygen reaches rest of our body, and only then can our organs function in absolute harmony, in absolute well-being. The next thing that I suggest all my patients post COVID-19 recovery is that at least for the next 2 weeks, that is 14 days, you need to observe social distancing, wearing masks, hand sanitization, minimal interaction with your near and dear ones, because you are still in a compromised state. You can again get infected. The antibodies will take at least 28 days to reach a level that can be called as a peak. So within that time, you are still a very viable candidate for recapturing COVID-19. And COVID-19 reinfection is very severe. So you need to be careful about that. On the medical part, you should continue the vitamin supplements, that is the vitamin B complex, the vitamin C. But then any medicine should not be taken as a alternative of proper diet, proper exercise, proper mental health. We should not take it as an alternative. Every vitamin, every medicine has a limitation. You cannot keep on taking vitamin C for lifelong. You cannot keep on taking zinc and vitamin B complex for lifelong. You'll have to take them for 15 days, 1 month maximum, and then stop it. The next thing that you need to do is you need to do meditation and have a good mental health. A stress-free mental health is important for a quicker recovery. This virus is going to break every bone of your body. That is the kind of pain, that is the kind of weakness you are going to experience due to COVID-19. The only way out is our soul's effect. I'm telling this both scientifically and spiritually. This soul, the mind of our body, has a great power to recover, to rejuvenate yourself. When it is in your mind that you are sick, you will be sick. But when it is in your mind that you are all right, come what may, you will defeat it. No deadly virus can defeat you. How do you think these people, 102 years, 120, 104 years, 90 years, 99 years, how do you think they are getting over COVID? They are at a very severe risk of succumbing to COVID-19. But then how do these people recover? Because of a very strong and positive mental attitude. You need to be very positive right from the time you hear that you are COVID positive till you become COVID negative, and hence on. You need to be very positive mentally. You need to live a stress-free life. People may joke our Indian traditions, but our pranayams are the best breathing exercises that can revive the lung. be it the Simha Yoga, be it the Anulom Vilom, be it other pranayam exercises, or just simple taking long deep breaths. This is going to revive your lungs, this is going to revive your cells. You try it, otherwise, also, you will feel a new energy, you will feel rejuvenated. Lastly, in the post COVID care, what is important is you need to take proper rest. You need to understand that your body has come out of a very serious disease that has affected every cell, every part of your body. We don't know what is the long term effect of this virus, because this virus is very new to come out with all those studies that it is going to cause these many permanent changes. But remember, COVID-19 is causing some kind of changes in your body which is not very normal. You need to be careful about that. For that, you need to be upfront in this fight against COVID. To recover, the medicines, the vaccines, they are all there to aid you, but it has to be within. That film that said, all is well, it actually works. Try it and you will recover fast. Don't judge your number of days in the hospital, don't judge the number of days you take to recover. Judge the quality of time, the quality of uh, treatment you received, or the quality of time you are taking to recover. That is important. This COVID 19, if fought together, will be a virus of history. But yes, what is important is stay safe, stay positive, and give it a good fight. COVID 19 is just a viral disease and it will go away. We just need to be aware of what is right and what is wrong. Lastly, there is questions about once COVID positive, when you can take a vaccine. The recent guidelines suggest that you should take the vaccine 6 months after being COVID positive. But looking at the severity with which these vaccines are, these pandemic is spreading, I personally suggest my patients that if you have not taken a first dose, then take it after 2 months of being COVID positive. If you have missed the taken the first dose but not taken the second dose, then take it after 14 to 28 days of being negative. Take it and get it done. Even better, after 28 days of being COVID positive, get your antibody tested. If you have good number of antibody, then wait and watch, and if the antibody is below certain threshold, then get the jab. Protect yourself. Wishing all those patients who are recovering from COVID a very safe recovery, and all those otherwise listening, my only one take home message: good food, good exercise, no stress, some supplementary medicines, and meditation. COVID will go away. Thank you.